ladies and gentlemen. I'd like to talk about the topic of discrimination in the trans population. HIV/AIDS comes from the hands of poverty, social exclusion, institutional violence. It comes from gender-based violence and, of course, all violence perpetrated against trans people when we cannot access to health care without discrimination. Governments and states are in violation of all human rights of trans people, especially the right to identity and gender in trans people, to have access to quality services, access to human rights, and access to services where we can access them without a fear of discrimination. Ill treatment and exclusion, which is our experience of trans people in our region, is very strong. It leads to HIV/AIDS rates of 35% in our population, exclusion, hatred, and, as I said, access to services which are unavailable to us. The right to gender and a right to identity is enshrined in law, should be enshrined in law, and that is the main barrier to trans people not being able to have access to what every other citizen has access to. This should be discussed in Parliament, and the right to identity needs to be discussed. It's a universal right. It's a person who doesn't have a name, who doesn't have an identity, doesn't exist. And for us, for the political agenda of governments and their plans, we just don't exist. So what's necessary is to deepen the HIV agenda in our region. In a time of a pandemic, the COVID pandemic stripped away all the veils that the states have, the lack of resolutions to respect identity of trans people. In those countries where there's a law about gender and identity, there is a decrease in HIV/AIDS rates. We can have access to treatment if we have identity. And in there, we can meet our needs without having to face the violations that what we're asking for from the United Nations and what we're asking for from all governments is first that there be a discussion and enactment of laws whereby trans people can enjoy an inclusive democracy and whereby we can access to all the benefits that all other citizens around the world have access to. And poverty also impacts. 29.9% of trans people live below the threshold of poverty. We die in the hospitals in total exclusion, complete isolation. We do not receive care, quality care, or any respect for our identity. Trans persons have access to health care just a few days or hours even before they die. And the issue of mortality, HIV/AIDS, that's the main cause of death for trans people. The second is hate crimes. And the third cause of death is poverty and forced migration. We trans people say that without human rights, we will not have access to prevention and care and universal treatment. What's needed is to deepen the healthcare agenda in our countries, and it's necessary to create inclusive spaces for trans persons. At this time in our region, the death rate for trans people is between average age is 20 to 24 years of age. We need to talk about sexual exploitation also for trans men and women around the world, and launch campaigns, awareness campaigns that would be effective, that would be launched by trans people. And one of our requests to all governments is that we be included in the political agenda. We need to be included in their political agendas, an agenda of prevention, care, and treatment. In our region, you can't talk about the violence of treatment. The violence inflicted on us is very strong. It's inflicted by the institutions. It's inflicted through complete rejection by healthcare providers and institutions. The violence against us is very strong. So what we need to do is work together to try and create an agenda together, a political agenda whereby we can first and foremost eradicate discrimination against trans people and enact laws that will benefit us and protect us. So we have all the social, economic, political, cultural, and environmental rights that all citizens in the world should enjoy. And we say to the United Nations, it's necessary to deepen this agenda. Trans people are not just a thesis. We are people, citizens, and we need access to all benefits, just as every other citizen accesses those benefits. Thank you very much for allowing me to present, and I hope that we can continue working together to decrease and eliminate discrimination and the damage caused in terms of HIV/AIDS, especially for trans people. Thank you.